Okay. Hi, everybody. My name is Alyza, and I'm one of the physios who work with Wellness Embodied. Welcome to our Thursday afternoon Facebook Live video. Today's topic is going to discuss exercise during pregnancy. So this is quite a contentious subject in the fact that there's a lot of misinformation out there in the role of exercise during pregnancy and how it can help women get through their pregnancy, and also how it can help improve their physical and mental health well-being. So the first thing to be aware of is that exercise is one of the most beneficial things for a female to participate in whilst she's pregnant. In saying that, the exercise that she's participating in needs to be at a suitable standard for her individual needs and target her individual deficits without posing a risk to the mother or the baby. So, during pregnancy, as you know, there are a lot of changes that the female body undergoes in preparation for birth. It includes body shape changes, body composition changes, changes to fatigue, your emotional and mental health, as well as changes in what we call your ligament laxity. So as our bodies get ready to birth a child, our ligaments become quite a bit more stretchy. There is also the fact that while you're pregnant, obviously you're growing a human baby, and it is going to put a lot of pressure on your tummy muscles and also on your pelvic floor. So there's always that to consider as well. So what should be some of the considerations when you're exercising? So first of all, if you have never exercised before, it is obviously unadvisable that you get into exercise that is high intensity and is very difficult to complete, especially things like high intensity interval training or impact training like running. If you are wanting to have an active pregnancy, obviously you will require clearance from your health practitioner first on your medical suitability for exercise, and also speaking to a health professional about what exercise types might be suitable for you. If you have never exercised before but you're wanting to get into some exercise whilst you're pregnant, some light cardiovascular exercise is generally okay, as well as some light body weight exercises. So things like going for nice gentle walks and doing some nice body weight exercises that aren't putting too much pressure on your body. So staying away from things like really hard sit-ups or really hard planks. Within the first trimester, exercise goals can include maintaining your muscle strength and function, increasing any muscular strength, increasing the strength in your pelvic floor muscles and core, which is super important in having a really sort of good recovery following birth, and trying to stay active as much as possible. It is really hard in the first trimester because you do suffer from a lot of fatigue. Obviously, every woman is different, so some might suffer more than others. Some might not get fatigued at all. In this instance, it is very important that you learn your own body cues and body signals about when you've had enough and when to stop exercising. Some things to watch out for whilst you're exercising during pregnancy include having trouble catching your breath, feeling dizzy, having chest pain, having heart palpitations, or if your heart's beating in an irregular way, feeling tightenings in your belly, if you have your waters or the liquid around your baby is leaking, if you have any bleeding from your vagina, if you feel any pain around your tummy, pain in your pelvis, if you feel really exhausted or have a bad headache, if you feel really weak, any pain or swelling in the lower part of your legs, or if your baby isn't moving as much as usual, it's probably not a bad idea to cease what you're doing and go and seek help from a medical professional just to make sure that everything is clear. If you're feeling healthy and well, generally light to moderate intensity exercise is best. In the second trimester, goals for exercise can include those that address any aches and pains that you might be developing. As you know, your posture is going to change. You've got this big belly growing out in front of you, and as such, it's going to change how your body moves and where your center of mass is situated. So it can kind of create this overbalancing force that's kind of pulling you forward. So when that happens, there can be changes to how your back is sitting and how your muscles are activating, and you can experience, it is not uncommon for women to experience some uncomfortable aches and pains, particularly around their lower back and pelvic area. If that is the case, exercises need to be mindful of this so that you're not putting too much pressure on those areas that can then exacerbate your symptoms. If you are experiencing any of these difficulties, obviously it's important to go and get them checked. Seeing a women's health physiotherapist is definitely recommended to have a look at that pelvic floor, but also coming in and speaking to one of the staff at our clinic just about what exercise might be safe and what might be effective to reach the goals that you need to achieve. Within the third trimester, obviously you're getting ready to have a baby. So what we need to consider is that this is where you're going to have the most growth in your belly. You know, you're going to have this big belly sticking out in front of you, and that can sometimes make you a bit more cumbersome and get in the way of doing certain exercises. So you might find that you have to modify some exercises, lower the intensity, just to make it all a little bit easier to cope with if you were feeling like you wish to exercise that day. Some goals would be to maintain a comfortable level of activity, again listening to your body and watching out for those signs that you're overdoing it, as we talked about just before. Beginning to prepare for the birth, so working through your pelvic floor and connecting it to your breath. Reducing any risk of putting downward pressure on your pelvic floor, so like things like breath holding or doing core exercises is generally unadvisable when you are in any trimester, really, in your pregnancy, but particularly in the third trimester. And also continuing to learn how to activate your pelvic floor and deep core muscles to reduce the risk of sustaining a significant separation in your abdominal muscles. So following birth, every female is going to have a separation of some sort in their tummies. It depends on how well they recover as to how quickly that gap reduces. Some women will recover quite quickly, other women might take a little bit longer. So trying to learn how to activate your core and pelvic help to mitigate this recovery and kind of speed it up as much as possible. With exercise during pregnancy, it's generally recommended that you follow a few simple guidelines. So staying away from exercising in those hotter parts of the day or where there is lots of sun out to kind of increase your body temperature. So maybe going out, if you're going to go, say, for a walk, you might like to go early in the morning or later in the afternoon. Avoiding exercises like jumping or impact exercises if you have never done so before, of course, but also if you're not feeling comfortable, because obviously you've got a change in the way your body is structured, so it might cause some overbalancing. So we want to make sure that people are safe while they're exercising, and making sure that you have plenty of water available before, during and after your workout, and that you eat a good nutritional meal before your workout and afterwards to make sure that you're sustaining your nutritional levels. Finally, with exercise during pregnancy, it is highly recommended, obviously, as we mentioned before, that you do get clearance from your medical professional before you begin. If you have been someone who does a lot of high intensity exercise in the past, it might be feasible for you to continue some form of that type of exercise. If you are desperately wanting to participate in certain forms of exercise that you really enjoy, then there are definitely ways that we can modify those exercises so that they're safe and effective for you. Finally, I just want to address exercises that target your abdominal muscles, and particularly those that involve laying on your back. So as the baby grows, Obviously, laying on your back is something that we tend to avoid for long extended periods of time, even for short periods of time if possible. So the reason for that is that the weight of the baby can sometimes crush an integral artery that runs down and supplies the lower part of your body. Symptoms and signs to watch out for can be a tingling in your legs, changes in sensation, weird something feeling not right. If you feel like you've got any of those signs whilst you're laying on your back, it's definitely time to stop and go and seek help. If there are exercises that you wish to do laying on your back, it's definitely important that we modify them so that this risk is mitigated. We can do so by creating a slight incline so we take away the effect of gravity, but again that needs to be performed in conjunction with a health professional such as a physiotherapist before you go and modify that. So if you're wanting to perform certain exercises targeting your core that require laying on your back, I suggest heavily that you go and seek a little bit of assistance before you go and try those in your normal workout. If you have any questions about exercise during pregnancy, please leave a comment below and we will get back to you as soon as we can. Thanks for joining into today's live session, and we will see you all again soon. Thanks. Bye.